As we know, much attention has been previously directed toward concussion in football and at the professional and collegiate levels. Well, what we're going to talk about today is moving away from that tip of the iceberg. We focus on the larger problem today, which is concussion in the student athlete in youth sports and the effect of that brain injury on academic learning and performance. We know that learning in school is the child's job, and that job is impaired after a concussion. Concussions are a serious matter, and it's not simply a football matter. Concussions occur in all sports, and let's watch a quick video just to demonstrate that. That's hit number one. Here's our problem. He plays the next day. So this is a clip of 2 hits, 2 injuries, 2 concussions. The second injury was likely made much worse because the first was not recognized. Now, the athlete, when you talk with him, actually reported symptoms, but he didn't know what to do with them, and no one recognized them on the ice. So this is our first big problem, poor recognition of the injury. It highlights our need to improve that identification much more acutely. As a result of this injury, it took the student athlete a month to recover rather than a much shorter period of time had we identified it early. We also have in our presence today a guest, 14-year-old Sarah Rainey of Alexandria, Virginia, who is currently recovering from a concussion sustained in April playing soccer, where poor recognition of the injury contributed to her lengthy recovery. And let me tell you, I've provided written testimony, but if you only have limited time, read Sarah's testimony, not mine. I think it's much more effective. So what is a concussion? What happens to the student athlete's brain when hit? A concussion is a brain injury. It's a force to the head and brain that results in electrical and chemical changes, and it changes that brain's biological software. It produces a whole host of signs and symptoms, physical, cognitive, emotional, and disrupts sleep. And with our next slide here, we're going to take a look because what we see in this next slide is we know that the time to recovery from brain injury varies widely from months, weeks to months, and for some years and beyond. And this slide that's coming up shows the wide range of time to recover of a group of high school athletes. And the brain is impaired during this time. If the slide doesn't come up, that's fine. The point is that it took a long period of time for these kids to recover. And one of the aspects of that slide actually shows us that those who have sustained more than one concussion took longer to recover. Now, how does this brain injury then affect the academic functioning? Well, if you take this combination of symptoms, cognitive, emotional, physical, it clearly affects that individual's ability to learn and to remember, and it decreases their tolerance for performance. So the new learning is impaired. They cannot perform reading, math, and writing effectively. They're slowed down. Their access to their knowledge and information at tests is also a problem. We also know that schoolwork places a significant demand on the brain's impaired software, and that the symptoms worsen as they try to think and learn. So this is called cognitive exertion, and it worsens symptoms as you try to mentally concentrate. And we believe that this becomes a major problem, and if you overexert for too long, then it can delay recovery. This next slide that you see here is some recent research that we have done that shows that 80 to 90% of the students in this study in our clinic experience these negative effects in the first month of injury, and about half of them continue to have those problems well into a month and a half. So learning is impaired through this entire time. Well, how big is the academic impairment following concussion? Well, we don't know that at this point. What we know is that most of our student athletes, certainly as this sample shows, have impairment over a period of time lasting a month or longer. What we don't know is the extent of the long-term problems yet. That's something that we need to understand. And what we cannot predict is who that individual will be that'll have the short to medium-term problem and the long-term problem. So what we've got to do here is to work toward changing this. School systems must be active partners to assist the students' recovery, but currently schools are not prepared for this. So they are not aware when students come back into their presence, and we need to improve that medical to school communication linkage. We also need to train our school staff to understand and recognize concussion-related learning problems and what to do about them. The good news is we're beginning to develop these materials to address these problems. We have materials such as an ACE care plan, which is part of the CDC's Physicians Toolkit that we use regularly to guide students' reentry. And the new CDC toolkit heads up to schools, Know Your Concussion ABCs, which is actually being released today, as we understand, on the CDC website, with excellent materials for school nurses, counselors, psychologists, teachers, and parents. Also in Colorado and in Oregon, they've been developing school concussion management programs. So our challenge is to implement, as a nation, supports for students with brain injuries universally, and to study the most effective ways to help them and to reduce these problems, minimize the negative academic outcomes. So let me just sum up now by saying that youth participation in sports is essential. It is essential to their development. It's a positive thing. But concussions in youth and high school sports are significant with direct effects on their academic performance. Learning in school is the child's job, and that job is impaired after the injury. We must better prevent, identify acutely and treat early, communicate between the medical, school, and athletic health systems, and effectively return students back to school appropriately. To do so, we need a universally accessible care system that really integrates all these key components together for student athletes with these injuries, but also for all students with acquired brain injuries. The PABI plan is something that we have developed, a set of professionals across the country to put this in place, and I believe you all have a copy of that. And we really look forward to collaborative efforts between the groups, the Sarah Jane Brain Foundation, the CDC, NIH, Departments of Education, sports, and medical groups to develop this appropriate universal evidence-based system of care. I'd also like to acknowledge the 14 members of a committee who are co-sponsors of this concurrent Resolution 198. Michael Castle, Yvette Clark, Joe Courtney, Marcia Fudge, Raul Grijalva, Maisie Hirono, Rush Holt, Dale Kildee, Dave Loebsack, Donald Payne, Robert Scott, Carol Shea Porter, Dina Titus, and David Wu, as we're really looking now to change the system. I thank you for your attention, for your invitation, and I look forward to to answer questions later. Thank you.